Hi everyone, my name is Christine Yang, and I'm an emergency medicine critical care fellow about to finish fellowship here at OHSU. And I wanted to talk to you all about why I chose this program and why I love it so much, and maybe some advice about how to choose the program that's right for you, and then just advice as a fellow. So why I chose this program, I mean, the obvious is right now I'm sitting in a cave right now, hiking with my program director on one of my days off, which is the coolest thing I've ever experienced. But really, the reason why I chose this program was truly for the quality of training that I know I would receive when I came here. I grew up in the South. I came from Texas. I was really nervous about moving so far away from home. I wasn't sure what it'd be like over here. It's very unfamiliar. I didn't have any connections, but I had heard about how amazing this hospital was and how beautiful Oregon was. And that together just seemed like the perfect adventure to take that leap and go and see what's out there. And it's been one of the best decisions I've ever made. OHSU provides training where I feel like I can become a specialist, a true specialist for my patients. Coming from emergency medicine, one of my biggest fears or my shortcomings was I felt like my training was very broad in the sense of I could do what to do. I knew what to do with the first step, but thinking about what to do with steps 2, 3, 4, 5 are steps that I wanted to learn and hone the skills. And OHSU is such a subspecialized place where there's plenty of ICU experiences, such as the cardiovascular ICU, you see heart transplants, you see LVADs, you see Impellas, to the neuro ICU where you treat subarachnoids and you become an expert in, intracranial pressure monitoring. And just learning every single topic with specialists that are so approachable has made me feel like I can become a better physician for my patients. And I feel like life in the hospital and life out the hospital has honestly been really good. A lot of people think about why do more training after residency. Residency is very grueling, but I can honestly say that fellowship has been one of the most fun 2 short years of my life. Being in the hospital and being the critical care specialist and truly learning and doing what I love, and then also having time off outside of the hospital to go hiking with my friends and new community that I trained here has been such a wonderful opportunity. I would say for anybody who is nervous about moving here, I would say that this has been, for me, one of the best choices that I've made coming here. I would say for anyone, thinking about how to choose a program, the one thing that isn't very conveyed well in interviews is that a lot of programs can always say how good they are, but it's really how does the program feel? And I can honestly say the leadership and the amount of support you have in your academic career and your career as a future attending, you have so much attention and detail to your part of training becoming the best doctor. And the amount that this program gives you to focus on your wellness and personal development and well-being, that's something that's very rare in medicine, and this program strikes a really nice balance between the two. And I truly feel like I can say that I'm very happy that I was able to train here, not only to really become, more education-wise, more robust in my learning, but also as a human being. All the growth that I've had these last 2 years has been more than I could have imagined. So I would say for anybody that is thinking about fellowship and how to be a good fellow, I would say to always be humble. When you come out of a residency, you feel like you're on top of the world, you've trained, you've become an attending. But as you enter fellowship, it's a whole new world where you feel so small and you may feel you know nothing. And to approach it in a humble way and to also accept what you don't know and always ask the why for everything and learning to operate within a team is going to be your best asset to becoming a successful fellow. So I really loved moving all the way from the South to Oregon. I loved the adventures of really inside and outside the hospital, and I feel like I found a great community here, both inside and outside the hospital, and I'm really thankful that I'm here.